And we have in the studio Ndak Zumnan, who is a project manager of Impact. Sir, you're welcome to Panorama.
Thank you so much, and I'm happy to be here. Good afternoon, listeners.
Okay, we are aware of the approval for the upgrade of 84 primary healthcare centers in Plateau State. Can you tell us how far?
Yes, sometimes in February, the Executive Governor of Plateau State, Barrister Manasseh Caleb Mutfwang, awarded contract for the upgrade of 82 primary healthcare centers cut across the 17 local government. And as you listen from the background report, each of those facilities will be upgraded. The main building, there will be a staff quarters, there will be a perimeter fence, there will be a motorized borehole, and there will be solar for 24/7 supply of light, and also a security house. Now, the essence is we want to take healthcare back to the grassroots. Enough of time where you see somebody living in Southern Plateau and the person is sick and you're traveling, taking the person back to Northern Plateau to go to Plateau State Specialist Hospital or just University Hospital. By the time you upgrade these facilities and you have a staff quarters, it's an indication that there will always be a health worker 24/7 in the health facility. And the essence of having that motorized borehole is to ensure cleanliness in all the wards, the labor room, the OPD, and every other place that the patients can attend. And of course, I forgot to mention that there will be a befitting toilet built outside the hospital so that patients can access if they want to ease themselves. And you know that a hostel is supposed to be a serene environment, that once you're entering, the neatness of the hostel start giving you that healing process. But if you are going into a hostel and the building is dilapidated and the environment is so tattered, you feel as if you're not even safe. But when you have a serene environment, you attract more people. As I listened from the background information, there was a lady that was saying that it will enable them to always ensure they come to the facilities. And one of the reasons why the government and the World Bank embark on this particular project is, before now, we have a lot of women attending antenatal clinic, but fewer number of them come back to give birth in the hospital. Before now, we have a lot of women, children that have fever. Instead of taking them to the facility, people prefer to treat them at home. But we want to see that every pregnant woman in every village in Plateau State have access to quality healthcare, and they are being attended to by skilled birth attendants, and to encourage them that we do not want to have maternal mortality, infant mortality. We want to reduce it to the barest minimum in Plateau State, and that is key into the vision of the Executive Governor of Plateau State, to see that he doesn't want to lose any child as a result of childbirth, and we don't want to lose any woman as a result of childbirth, and any child under 5 should not die of fever, but to have access to these PHCs spread across the 17 local government.
Okay, you've spoken about how the project will enhance the PHC services. So Can you tell us what the challenges are and how you're tackling them?
Yes, before now, we have the problem of the structures, which is being taken care of. And before now, we have the problem of, I said earlier that many women, you go to a particular PHC, you discover that, okay, you have 100 women attended antenatal clinic, maybe in the month of April. It's expected that at the end of, by the next in the 9 months, you should have 100 women coming back to give birth in the hospital. But it will surprise you to see that it's only 20 or 30 of them that are coming back to give birth in the facility and be attended to by skilled birth attendants. That is midwives or anyone that has been trained to, actually conduct delivery and deliver a pregnant woman safely. Now, we have such challenges, and we realize that most of those challenges are as a result of the facilities do not have the befitting equipments, they are not well furnished, and we do not have human resource for health, which is the skilled birth attendants I'm talking of. So His Excellency have keen into recruit more people, upgrade the facility, then we encourage the women to always come back and give birth in the facility. You will recall again, last 2 weeks he launched the Mama Kit, which is the delivery kit, free of charge, that will be found in each of the facilities that every pregnant woman can have access to.
We're running out of time. Just a message for the contractors on the level of work in few seconds.
A message for the contractors: His Excellency do not want to take any shabby job. Not only His Excellency, but our partners, the World Bank, that bring out money to ensure that this work is being done.
Thank you so much. We've been speaking with Mr. Ndak Zumnan, the project manager of Impact.